Good evening. I'm Dr. Thirumalesh Reddy. I'm the senior consultant in orthopedics, and my specialty is arthroscopic surgeries and joint replacement surgeries. So today we're going to talk for some time regarding joint pain in general, and particularly arthritis involving the lower limb, meaning the weight-bearing joints. So basically, arthritis is something which most of us as a common man know about to some extent. So arthritis is basically something which involves the joints where the cartilage starts wearing out, takes time, eventually leading to symptoms, the most commonest being pain. So which is why it generally draws our attention to that. So arthritis is a progressive condition, starts off at around middle age, generally depending on various factors, may progress to an advanced condition. Now, there are different types of arthritis that are commonly seen amongst us, and broadly they can be divided as arthritis secondary to aging process, which is called as osteoarthritis, and which also happens to be the most commonest type of arthritis. This is mainly related to the aging process and generally starts off at around middle age and progresses to an advanced stage in some of the people. During this course of our discussion, I'll be answering any questions which comes up in between. So I may break my talk in between. So there's a question here who says, who gets arthritis? So as I said, arthritis are of few types. So the commonest being osteoarthritis, which I said is related to aging process and natural processes. And the other types of arthritis are something related to metabolic conditions or inflammatory conditions like rheumatoid arthritis or any other inflammatory conditions. Also arthritis resulting from infections, injuries around the joints, with over a period of time can cause arthritis in those conditions. So generally, when we say osteoarthritis, it's mostly osteoarthritis that comes up to mind. So these ones are most commonly seen in women, especially in our country, possibly because of the kind of lifestyle they're used to, and also more common in people who are obese, overweight, and generally over the age of 60 and 65 years is when arthritis draws our attention. Now, apart from this, as I said, the other causes of arthritis, inflammatory or secondary to injuries, anybody can get affected. So there may be some certain predisposing conditions to any of these. So that is something, a different background altogether. Now, why actually arthritis draws our attention is mainly the pain. Arthritis means the cartilage, which is a protective lining between two bones, which is a joint, that wears off over a period of time. So when it's very minimum or in the early stages, generally we don't get our attention drawn to that. However, at some point when the threshold is crossed, then yes, pain is the first thing which will draw our attention towards that. So if the condition continues to progress, then the pain can get more intense, can start affecting one's routine lifestyle, daily activities which they previously were able to do comfortably. And depending on the stage of the arthritis, there can also be stiffness in the joints, difficulty to move the joint, and also at some point when the arthritis is very severe, the individual affected may have difficulty to walk even a few yards or a few steps because of the pain that is involved. Apart from that, they can also have some deformities because of the arthritis. If the arthritis is involving the knee joint, then they can see a bowing of the legs at an advanced stage. They're also limiting their physical activities, causing them to waddle, walk sidewards, leading to back pain and also neck pain, hip joint pains, all secondary to arthritis of a particular joint. So there's a question about, is arthritis of the joint pain and arthritis are same? Is it age related? Joint pain, as I said earlier, can be because of so many other conditions. It can just be simple strain which may or may not be involving the cartilage at all. Whereas arthritis is something, it's a medical word, depending on the stage. It can be, it basically involves the damage to the cartilage lining. Whereas joint pain need not be arthritis. It could be something different, temporary, which can be completely reversed. Whereas arthritis is something which is a progressive disorder, as I said, cannot be reversed. However, the progression can be modified by a lifestyle, or if it's a metabolic condition, then by appropriate medical measures to address that. So, in a large context, the joint pain mostly involves some extent of early arthritis. So, as I said, there's a question asking how diagnosis can be made. So, first thing that draws our attention would be pain. So, when this doesn't go away in a day or two, or if it starts bothering us, then that is when the person might seek the doctor's attention, advice. So, at that point, a clinical examination would help us to assess the cause of the pain. If it's arthritis, that will give us a lot of information from a doctor's perspective. And sometimes we may have to do some tests to confirm, especially to determine the extent of the arthritis that is involved. So, the commonest one would be by a simple test called an X-ray. So, this will show us a lot of details about whether a person has arthritis or what extent that is involved. In conditions other than the age-related arthritis, so diagnosis can be helped by certain lab tests to see if they have any inflammatory condition like rheumatoid arthritis or metabolic conditions like gout, these things. So sometimes an X-ray also can show up some underlying conditions of a joint which have been there from birth or from early childhood, which also potentially can lead to arthritis in the due course. So these are some of the commonly used tests. There are, of course, other tests, more elaborate tests like MRI scans or CT scans, which generally are not necessary to diagnose arthritis in general, but will help us to understand the cause, and will also help us to plan treatment in a better way. Occasionally, the MRI scans may be necessary when an X-ray is completely normal, whereas we'll have a high suspicion of a possible cartilage damage, which usually is seen in a younger person involving an injury like a sports injury, where an X-ray might turn out completely normal. So in those situations, an MRI scan would be very useful to diagnose any cartilage damage in that person. So the signs of arthritis, the early signs of arthritis are important, because that is the point where the person can actually make some changes to try and modify the course of the arthritis. So as I said, the pain is the first thing that will draw attention, usually noticed with some strenuous activities or some unusual activity like an exercise or a sport which someone plays if they're not used to doing that, or even people who play regularly if they do something in excess. So that is when they start noticing pain. And these are usually seen in the weight-bearing joints. That will be the knee joints or the hip joints, or sometimes even the ankle joints. So that is something which will be an early sign to pick up with. And depending on what the person does at that stage, if they take some corrective measures and avoid those triggering reasons, they may get back to their normal lifestyle. If not, it may progress to increasing pain, increasing severity of pain, sometimes even swelling of the joint because of the inflammatory changes that happens. And further, when it continues to progress, it can cause stiffness, difficulty in bending that affected joint. Sometimes when there's a very sudden increase in these things, they can also feel some warmth around that joint involved. Those are the early signs that one has to be looking for regarding arthritis. So arthritis pain, the treatment of arthritis basically, when it's a generalized joint pain not related to arthritis, a simple rest which most patients do it themselves should take care, and they usually know what has caused that. But a pain because of arthritis is when it keeps recurring repeatedly, and there would be an extent of affecting they would be affecting their lifestyle activities to some extent. So to treat these ones, the early stages, generally the simplest measures would be rest, which is most important. When I say the rest, it means involving a knee joint, for example, avoiding standing, walking for a longer time, or even climbing stairs. If you avoid these things, so that would give the affected joint some rest, and generally the pain settles down with that. If it's not enough, then yes, a hot fomentation, a hot bag will also supplement to that. And the medical support would be the most commonest would be by some painkillers, anti-inflammatory tablets, and for a few days, depending on the extent and the severity of the pain the person has. So these are some of the commonest used measures to get the pain controlled. Sometimes, apart from these things, we can also treat the person with some physiotherapy, and also depending on the stages of arthritis, if it's a little more advanced than early stages, then there are measures where we infiltrate the joint, we inject the joint with some supplements, which would give the person some pain relief for a few months at best. And apart from that, exercises to try and prevent recurrence of the pain because of the early stages. The treatment of arthritis at a later stages is probably may not be enough with these simple measures. So depending on the extent of the cartilage damage that has happened, the treatment can be planned accordingly. So to some extent, moderate level of arthritis patients certainly may not be required to undergo any surgical intervention. So in them, certain lifestyle modifications would certainly help them feel better, like reducing any weight-bearing activities and avoiding or preventing strenuous activities to these joints, like climbing stairs, sitting on a low chair, using squatting or sitting cross-legged for any of their routine daily requirements. So by avoiding these activities, they would certainly and naturally feel a lot of improvement in their symptoms. And if the arthritis is further advanced, like which means they are all beyond amenable to these measures, then in those patients, a surgical intervention may be necessary. So these, again, the surgical measures may also vary depending on the requirement and the type of arthritis that the person has. So broadly saying, these can be corrective measures to try and delay arthritis, especially if this involves a younger person. So these can be correcting the alignment of the affected bones. It's called osteotomy. And this would not cure the arthritis. However, this surgery would prevent them from developing the advanced stage of arthritis. So apart from that, there can be some minor issues which can be treated by a keyhole surgery and required measures during that. And eventually, when all these measures are exhausted, or if they're not something that is suitable for the person, which means the patient is having an advanced stage of arthritis, so in those conditions and those people would need a total knee replacement or a hip replacement, depending on whichever joint that is involved. So this would be replacing the worn out cartilage with an artificial or a metal joint. So that would be the last line of treatment, usually reserved for people who are elderly, 60, 65 plus, and in patients who have advanced arthritis where the cartilage is completely worn out, and in those people who are having difficulty to go about their simple routine activities. However, occasionally these surgeries may be required in younger people, but that will have to be balanced by a detailed discussion by the patient and the doctor involved. So there's another question asking, is chikungunya related to arthritis? Yes, some of these infections can cause joint pains, and these are all generally reversible, which would not last or progress beyond a certain point of time, although it may vary from person to person as to how long these would bother them. But during the time that it's affected, yes, they would have joint pain, which can be called as arthritis. So there's another question asking if arthritis is permanent. As I said, we can't say that as permanent, but the true arthritis is something which is a progressive condition. It doesn't stay as it is. It starts off with, at a very simple stage where none of the tests can actually diagnose the early stage, and to the other extreme where a non-medical person also can say that they have arthritis looking at the X-ray. That is the difference. That's the spectrum of severity that the arthritis can be affected to. So it's a progressive condition. It's not going to be as it is when it's first diagnosed, whatever stage. At some point, depending on various factors like hereditary, genetic, lifestyle, the weight of the person, any injuries, the kind of occupation the person is involved. So a lot of these things will certainly have a significant role in determining how fast the condition progresses to the next stage, leading to increasing their symptoms. And so at no point we can actually reverse this condition. So I'm not sure if we can say that as a permanent, but it's not something that we can reverse or get rid of that. The other the non-osteoarthritis type of joints, yes, they can be temporary. Like say, for example, rheumatoid arthritis. So it's something like a person having diabetes or high blood pressure. So I think most of us all know, even the non-medical people, that we cannot cure these things. However, with appropriate medications, these conditions can be kept well under control. So rheumatoid arthritis is one such thing. So with proper diagnosis at the early stage and with proper medications, so the effects, because the ill effects of having rheumatoid arthritis can be kept under a good control, so that the person doesn't have the damage to the cartilage in due course of time. But generally, at some point, most of them would have cartilage damage, but the time it takes to reach there might vary from person to person. So other conditions like gout, yes, that's another form of arthritis, but then yes, it can be reversed. And again, as we discussed, once because of infections like chikungunya, those sort of things certainly can't be permanent. They generally are not permanent. So age group, what age group suffers from arthritis? Yes, again, the osteoarthritis, which is the most commonest type and which doesn't have a clear reason as to why it happens. Most of us will end up having arthritis of some form to some extent. The only thing that can vary is the point at which it affects that individual. So people who have arthritis running in their families may be affected at an earlier age. Otherwise, there are people who are in their late 70s, early 80s, who may have very mild arthritis, but still not basically having their attention drawn to that. So age, generally it's an elderly age group, say around 50, 55 is what we generally see, people who start having their attention drawn to the knee pain or hip pain or ankle pain, which cannot be ignored by them. As age progresses from that point onwards, it's generally getting more frequent and more severe in nature. The other form of arthritis, which is like inflammatory, generally affects much younger person during the second or third decade. In a rare instance, even children under 10 years of age can be affected with rheumatoid arthritis. And gout arthritis also generally seen in a much younger age group. and infections, of course, anybody can have infections depending on the reason or the type of infection that they have. And post-traumatic secondary arthritis is when arthritis develops because of damage to the cartilage or the joint because of a fracture close to that joint. So that again, usually it's seen more in the younger person who are more prone to have injuries or accidents, and generally elderly people are not seen in higher numbers in this background. So how will I know if I have arthritis? I think we've discussed about that. Pain is the first thing that will draw our attention, and if it's something which cannot be missed, and if it's something that doesn't settle down with simple measures, home remedies, and certainly they'll visit a doctor, and then from thereafter they'll probably be under follow-up at some point. They'll be aware of that one. So arthritis secondary to any metabolic condition or inflammatory conditions probably may start off as a very low intensity, low severity pains. More than one or two joints could be involved. Again, it is something which cannot be missed by the individual because it doesn't settle down without medical intervention. And again, lab tests and these ones would help us to diagnose, and that's how one will get to know what type of arthritis they have. So someone wants to know if sitting for a long time increases the back pain. Back pain again, because it involves bones and joints technically in some form. Continuously sitting can lead to back pain because a lot of things need to be attended to when someone does a desk job who may have to sit for a long stretches on a daily basis. It can lead to back pain at some point, especially if certain ergonomic factors are not followed. So one has to sit with a chair with a firm backrest, lean against it, and if possible, try and take breaks every 45 minutes or 1 hour. Get up, walk around for a minute or two, and then I can get back to the chair. So these things will try and help the muscles and the joints to recover, and will help us to avoid getting back pain over the period of the life course. So there's someone who wants to know, a person who had chikungunya 2 years ago, but the pain continues. So it's very unlikely that the chikungunya itself could be the cause of pain that's persisting beyond 2 years, or some people even more than that. Depending on, again, the age group, they may also have some underlying arthritis because of the aging process or the normal wear and tear, which may not have been come to their attention because this happens very slowly over a long period of time. So they may not have actually drawn their attention to that. But most often, an episode like these fevers, chikungunya, or even sometimes dengue fever, these ones will draw our attention, and then it doesn't just go away from our mind. So it's possible that they may have an underlying arthritis which may not have been noticed by them because they got used to it. Some people would, without their knowledge, modify their lifestyles just to suit their comfort, thereby basically treating the arthritis at an early stage by themselves, not knowing that they're doing so. So unlikely that the chikungunya would be the cause for pain beyond 2 years. So apart from these ones, there are something which we can modify the course of the arthritis in very selected patients. Something called stem cells therapy, which is a little different to the traditional thinking of arthritis cannot be managed. But these are not generally applicable to a vast majority of people who have been diagnosed as arthritis, but to very select individuals. So basically what it involves is trying and repair the damaged cartilage, or even try and replace the cartilage by the cartilage cells grown in the lab, but these, as I said, is useful only in a very highly selected people, especially the young ones with sports injuries. But one should not be under the impression these stem cell therapies in different forms are a cure, is a cure for arthritis of the age-related type. So that is something which one needs to keep in mind. So apart from that, what I would like to stress is it's invariable. It's invariable that most of us, in fact, all of us, would be affected with arthritis at some stage at some extent. But a lot of those things would be modifiable, and a lot of factors involving our daily routine lives would have a larger contribution in actually making things worse or making things better for us. The important ones is it's important to engage themselves in some form of exercises to keep themselves fit, because exercises are something which will keep our joints and bones in a healthy condition. And it's also important when you say exercises to try and choose something which is called as a non-impact exercise. People who are beyond 45, 50, I would personally feel jogging, running, these sort of exercises are not very safe, but they can indulge if they've already been used to doing that at a low intensity. So apart from that, non-impact exercise like swimming, these would certainly be of great help to try and keep the person's body weight under check, and also make sure that the joint cartilage is well nourished because of the exercises. So apart from that, looking at controlling one's weight. If they're already overweight, take measures to try and reduce the weight. That would help in a big way in their due course to avoid arthritis reaching the advanced stage. So those are important. And also youngsters, considering the fast lifestyle that we are all getting used to, trying and avoid getting hurt around the joints, ligament injuries, which all would eventually lead to arthritis at some point. So these would help us to try and control the problems that we might face because of arthritis to a large extent. So someone asked, how should we maintain our knees so that we have less issue during old age? So this is again the same thing that we've been discussing all through. We cannot stop ourselves from having arthritis because a lot of other factors which are not modifiable will be having a lot of contribution in one developing arthritis. However, keeping one fit, avoid getting overweight, exercises to some extent, avoiding injuries, damages. A good diet would certainly help. Just taking calcium, hoping that calcium would get rid of arthritis, is a wrong concept. That wouldn't be helping us at all. These are simple things that one should keep in mind to try and minimize the ill effects of the arthritis. I think we've basically discussed the joint pains, arthritis in a large context, and hope I've answered most of your questions that you had. So we'll be meeting again shortly in the next coming few weeks.